Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Acute radiation syndrome. So here in acute radiation syndrome, this is when we are exposed to high radiation. So in case we are exposed to high radiation. So we are exposed to high radiation, that is greater than 1 gray. So exposed to high radiation means greater than 1 gray or the 100 RADs. Next is the prodromal phase. So here in prodromal phase, there is presence of the nausea or the vomiting or the diarrhea. So there can be nausea, vomiting or the presence of the diarrhea. Next is the incubation phase. So in case of incubation phase, there is no symptoms, there is presence of no symptoms. And there is in case of incubation phase, there are no symptoms. In prodromal phase, there is nausea as well as. So when you look at the prodromal, there was nausea as well as vomiting and in case of and also the presence of diarrhea. Then moving on, we look at the hematopoietic stage. The hematopoietic phase is where there is a bone marrow suppression and this is greater than 3 GY. So bone marrow suppression and this is greater than that of the 3 GY. Next is you have the GIT. The GIT is at the 8 to 15. So 8 to 15 GY and then comes the CNS. So CNS is again 10 to 25. CNS 10 to 25 GY. To learn and grow daily like this, please do subscribe.